Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, ATHLers. Welcome to our weekly show. My name is Abby. Welcome for all those of you who are joining me from the page, Abby Tyler's Healthy Living page, and also from the group and from YouTube and Focus on Liberia. I say welcome. Thanks for joining me. Please share the show. Before we start, my disclaimer. I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. So as you can see, today's show is tips for managing seasonal allergies. Okay, so this time of the year, the birds are chirping, the weather's getting nice, it's nice and warm. And depending on what part of the country you're in, if the seasons change and all that. So, and the part of the world that you're in also. So, and because of that, you're outside more and you want to enjoy, you want to go outside biking and hiking, going everything, having fun with your family and friends. But for some people, this time of the year brings on a season of allergies and it can like really hamper your life. For some people, it's just, take a little medication and you're here back and forth. You don't really need to take anything. Just watch the time of the day that you're out there. But for most people, some people, it can really hamper their life and all that, meaning that they can't go outside a certain time of the day. Their activities is kind of limited for like a really long time of the year, sometimes from like all the way from maybe April all the way to like, when the fall starts. So, so we're going to be talking about seasonal allergies today. Alrighty. So let's get in here. Let me just get my banner. Please share the show. Please share the show. Give me a thumbs up and all that. Alrighty. So I'm going to go to my banners here. Okay. So then we're going to talk about, the risk factors, the causes, risk factors, and symptoms and all that. All right. It's not going to be a long show. Okay, so allergies. What are allergies? It's like your body immune system already reacting to something that's seemingly normal, meaning there's something where it'd be like, oh, okay, people are just sneezing something in the air and your body does, you sneeze and you're done. But for some people, the immune system like overreacts to it, okay? And it treats it like something like, okay, that's an invader. Something's coming into our bodies. We need to get rid of it. We need to get rid of it. That's why you find yourself sneezing even more. You're coughing. You got this blocked sinuses and your headaches and all of that. So some people, their body overreacts to it because that's the way they're built and all that. So based on that, you're not the only person that suffer from it. According to the American College of Asthma and Immunology and all, it's like 50 million Americans suffer from that. They're just counting Americans now. We're not doing all over the world. So imagine that. And that can cause a pretty penning over a long period of time if you bother for a while. Okay. So some of the causes, again, grass. For me, I'm allergic. I didn't even know you can develop allergies later on in life too. I didn't have any problems with it growing up. And as I started getting older and I realized that when everybody was sick during the winter months, and then as soon as around this time, I started sneezing and coughing. I'm like, wait a second, how come I keep getting sick when everybody else is feeling better around this time of the year? So that's when I started realizing, I was like, oh my God, I have allergies, seasonal allergies. And then also I'm allergic to grass. So it's like if I lay in the grass, I used to love, just sitting in the grass. I usually have to put like a cloth on the grass. I could just sit on the grass like that. So you can develop allergies when you're small or as you're growing up. Alrighty. So some of the risk factors for that. Let me just go in here. The risk factors. The number one risk factor is like genetics. So if you have like a sibling, meaning a brother or sister, parent that had seasonal allergies, you're most likely to develop it. Where you live, the time of the, if you live places where like a lot of trees and all that, the seasons change. So yes, it's a high chance of you developing it. Sometimes I'm talking about seasonal allergies now, but sometimes it can be exacerbated by the fact that maybe you were born with asthma or you develop asthma later, or you have some lung disease where, COPD, or you have prone to bronchitis. Some people who are also smokers too, because anything that impairs the lungs and all, and when the histamines are coming into there, right away the body is going to overreact to that. So those are some of the risk factors. All right, so we're going to go to the symptoms. All right, so symptoms: itchy eyes, watery eyes. You see people walking around with like really red eyes. Sometimes it can be just really dry, itchy eyes too. Okay, nasal congestion where you feel over here like you feel like something's like blocking your nostrils there. Headaches because you're not getting enough. The body's not circulating the air in your face and all that in your face and your sinuses. That can block your sinuses, and you can have a sinus headache. Mild sore throat. I said mild sore throat because you have to know the difference between what to call the doctor. Okay, and sometimes it's like some people it's like fatigue because you go through that, you're sneezing, and you just don't feel yourself. You're like, I don't want to go out because every time I go out there, it's just going to get into my nose. So it's important, know your symptoms and watch for your symptoms too. So you say, okay, I'm getting this. If you're getting a certain time of the year, seasonal allergies. If you're getting them more during the year and all, then of course you want to check with your doctor to make sure that it's not something else more that's going on there. Okay. Alrighty. So let me just go here because when I talk to, I just dry throat. Okay. So what are some of the treatments for that? Alrighty. Treatment can be over the counter. You can get like you see your diphenhydramine, the brand name is Benadryl. Over the counter, they call that antihistamine. You can do the nasal spray also, because some people develop cough and all that, so you can get some cough medication. They have the neti pot where you can kind of flush out your nostrils and all. Inhalers. We'll talk about nasal sprays. The most important thing I want to say here, also, when I going back to the diphenhydramine, which is the brand name is Benadryl. If you have any elderly person there and you see they're having allergies, allergic symptoms and all, please make sure that you're not giving them that, because for elderly people and all, Benadryl will make you kind of sleepy anyways. So but if an elderly person, any kind of medication elderly people are taking, their body, as you get older, your body's ability to break down certain medications, it slows down. So if you're giving any kind of medication that may cause them to be sleepy and all, that can cause them when they get up, when they're sleeping and don't know, to get up at night, they're falling. Even when they're doing the daytime, they're high risk of falling. And especially those of you who, if they're still driving and all, that can make their ability to drive, they can impair their ability to drive. So it's important that you speak, if you have your elderly relative living with you, or your elderly relative living and you go visit them. If they're having seasonal allergies, make sure you speak to the doctors and all that too, so they can put them on allergy medication. So they're not doing, we try to stick Benadryl away from elderly people, okay? And even for people who are my age or younger, usually if you have any symptoms over and over, they want you to put in like a daily medication, okay? So that's all your Claritin, your Zyrtex, and all those different ones and all that, because those are the second generation, third generation medication. So it's not going to make you sleepy. They can still manage your symptoms and they're not going to make you sleepy. Okay, so it's very important. Also, the inhaler, I see people go around this stuff where we used to like kind of sniff on. It's like a little white thing, and I see people, they keep that to their nose for a very long time. Now remember now, because when you take the antihistamines, all the thing that the pollens put out in the air, okay, you take the antihistamine, so when the histamines are coming to you, it blocks it. All right, so when it does that, it kind of closes your blood vessels in your nose and it blocks it, the smaller blood vessels. But at the same time, also when it blocks, I also block some of your larger blood vessels too. All right, so what happens if you're taking high blood pressure medication? All right, if it's blocking, the medication is supposed to be going to keep your blood pressure open so your blood pressure stays down. But if it's blocking the major blood vessels too, that can put your blood pressure up even higher. So it's very important that even though you can take something over the counter, you still want to talk to your doctor about it to say, okay, this is what I'm going through. I need to take certain medications. Oh, I want to take something over the counter, but I just want to make sure this is going to be safe for me. So it's very important, especially for those who have high blood pressure. Again, making sure that you check first, because it does kind of, you're taking certain things, it blocks the histamines from coming into your system and it can close some of the blood vessels. So it's important that you make sure you get that checked. Okay. Alrighty. And again, if you didn't get anything I said tonight, try the diphenhydramine. Please do not give that to your elderly relative. You can ask the doctor and they can put down something daily. Like I said, your Claritin and your Zyrtec, unless if you're allergic to it and stuff like that. As always, like I said, I'm a provider. I'm not your provider. So please make sure you check in with your own provider first. Okay. And again, don't have that. And I see people walking around with a nasal spray. Keep that away from your nose. That's not safe. Right. So what are some of the preventive stuff here? Let me just go in here and see. I'm going to answer the questions in a minute. All right. So some of the preventions. All right. You have to watch the news every day, especially for those of you who live in places, again, where, watch the news for the pollen count. The higher the pollen count, the more aggravated you're going to be when you go outside, because the trees and everything, the grass, everything's in the air. much of that, and know when to be, your triggers, and also know your triggers, know your triggers. Alrighty. So if it's that's high, you say, okay, maybe I'm not going to be going out this time of the day, or making sure I take my medication, because sometimes you can help it. You have to go out, you have to work. Alrighty. So excuse me there. Okay. Sorry. Alrighty. So watch for the pollen count every before you go watch the news, and also everybody has it on their phone right now, so you can just go to the weather channel and just, or your weather app, and just check for the pollen count in your neighborhood. If you see, especially if you see it all over your car and all, try to wipe it down a little bit before you get into the car, because you're going to be breathing that. When you're going out to mow the lawn, what are you, woman and man, mowing the lawn, or you're doing some gardening, if you know that's going to bother you a lot, make sure you wear like an N95 mask or any kind of mask, but sometimes the N95 mask, because it's keep everything out. All right, so you can wear that. Make sure you keep your throat moist too. So drink a lot of water too, because when you're brewing, that's coming in, it can dry your throat. All right, so make sure you're wearing your mask when you come inside. Take the clothes off right away. Put it in the wash, or if you're not doing laundry right away, tie it up and put it with their other clothes. At least it stays there. It's not like in the air. Take a shower, wash your hair, brush it off if you need to. Also, the neti pots where you, like I said, you can kind of spray your nose, and you can also get a hip air purifier in a house that has a HEPA filter, so that can kind of circulate and kind of clean the air, so you're not breathing everything from outside as well. Keep the windows down, keep the windows closed and all, again, because even though the screen is there, the screen's not going to keep the air from the histamines from coming in into your house. And also make sure you can, if you have a pet and they go outside to go play and all that, or you have to walk them, or they come back in, wipe them down before bringing them into the house, and then make sure you wash your hands as well. Okay, don't let the pet sit into the chair in your bed if you're not wiping them down, especially if you have allergies. Okay, and also pets can have allergies too, so keep an eye out for them. If they're sneezing a lot, make sure you can call the vets and see if they need to get something too. Alrighty, they don't like taking pills, by the way. So your vets will tell you the best way to do that. Alrighty, so let me see here. So again, you can say, okay, well, wait a second. I have allergies, and but how do I know if it's allergies or fever? So again, like I said, if it's coming the same time every year, then you can say, okay, wait a second, maybe there's something going on here. I usually, because when you come to the office, again, we ask you questions about, okay, what is it? When did it start? What were you doing? All those different things. I talked about the different questions that we ask when people come to the office. So you say, okay, I usually get it around this time of the year. And then we'll say, okay, well, and then do you get this? Do you get these symptoms along with it? Do you get that along with it? So we ask those questions, so, to make sure that we get in the full picture. Alrighty. So again, when do you have to call the doctor? When to know when to call the doctor? If you developing any fever, temperature like greater than 100 over a period of time, that allergies don't cause fever. Okay, severe body aches, allergies don't cause that too. So you're dealing with something more than that. Severe sore throat too, because like I said, your allergies, when you're drying up and all, like you can have mild sore throat and some coughing here, but you notice like severe sore throat, and it's been going on now. All these symptoms are going on for over a week. You want to go on the timing too. Again, like I said, they're going to ask you, when do you usually get this? And also, like, how long have you had these symptoms that you thought you were just allergy? Now, remember, you can have allergies and have symptoms, additional symptoms. So you can start with the allergies and start developing like upper respiratory infection or something else. And then also, if you have, like, I say, asthma or other lung diseases, that can exacerbate, that can make it worse. So it's important that you're treating the symptoms, and all, you treating it early on, so you develop something more. But it's important, if you are having those symptoms, to make sure you call your doctor. Again, fever. Allergies don't cause fever. Body ache, severe sore throat. These symptoms been lasting for about a week. Sore throat, severe sore throat, especially if you're having problems swallowing, and all. Of course, you want to call before 1 week. And you don't have this not like 1 week where you absolute hard rule where you have to wait for these days. If you're feeling uncomfortable and it's getting more and more, you need to call. Okay. But especially if you're having shortness of breath, that's like beyond, and all, call 911. All right. So, and because some people, like, they have really bad, it's like seasonal allergies, but sometimes it can be, you can, manage it. And sometimes it gets really bad. Again, like I said, so it's important to always have your medications with you too. Okay. You can say, okay, yeah, I know it can be a little annoying and all that too, but if you have asthma, you want to always have your rescue inhaler, your maintenance inhaler, the one you take like maybe twice a day. You can have that with you, but your rescue inhaler, where you can use like every 6 hours for wheezing, shortness of breath, Of course, you want to have that with you at all times. Already, family members, like you have an elderly relative with you, make sure you have their medications. Again, follow the directions on the bottle. If you're taking anything over the counter, check with your doctor. If you have high blood pressure, to make sure that whatever medication you're taking is not going to interfere with your medication that's going to cause your blood pressure to go high. Because if your blood pressure becomes unmanageable, there's a chance of you having a heart attack or a stroke and all that. So it's important. So allergies can be a little bothersome for some people, but it can really be life-changing for others. So it's important that you know what your symptoms are, manage them accordingly, and manage them as early as possible. Okay. So I'm going to look in here and see. Okay, so I just see, okay, so no other comments there. So let me go back here. Alrighty. So I don't see any other questions. But again, like I said, I usually answer questions after the show. During again, I go in there and respond to other people's questions and all that. And also, if you have any other things, you can just inbox me. Alrighty. So that's seasonal allergies in a nutshell. Making sure that again, managing your symptoms as early as possible. If you have any other risk factors, again, like you have asthma and COPD and all those different other lung disease that's already impairing your lungs to be able to breathe better and to be able to react to it, talk to your doctor and again, it's just something where your body's like, oh my God, what is this? We have to get rid of it. We have to get rid of it. And you can't, the body's like, doesn't know how, that is not something strange that's not going to come and kill you. So your immune system is there to protect you. So it sees it that way and it runs into overdrive. So that's what it is, but it can be bothersome for some people. Okay. So please share the show, share the show, share the show. Other people might want to see it. Alrighty, let me just go in here and see. Okay. Alrighty. So again, I went over that. I talked about the causes, the risk factors, causes, problems, and all. So we mowed the lawn. I like going out to garden with my husband. I don't really garden. I can just go there to take the stuff and take the pretty pictures because I don't like anything touching my skin. So that's all a part of my allergies too. So I have to even if make sure that's why you see people who mow the lawn, the professional lawn mowers, they always cover up and all that too, because sometimes when that touches your skin, it itches so badly. So make sure you come in and you're washing yourself right away. If you have genetic factors, meaning your family member has it, check on that. Do it as early as possible. Okay, so any other questions, just leave it below and I'll be much, obliged to answer. Alrighty, so thank you all for watching now. For those of you who will be watching later, I say thank you. I try not to make it too long anymore, so that at least that way you guys can just come and get a little caveat of what you need to know. Alrighty, so I'll talk to you guys later. Stay safe, stay healthy. If you have not joined Abby Tyler's Health Living, please click the like and follow button so you don't miss anything, and also because sometimes Facebook doesn't always come on. So I do live videos on Tuesdays and I do Abby's daily dose during the week. So thank you for joining me from YouTube, from the Facebook page, and also from Focus in Liberia. Alrighty, thank you. You stay healthy and stay safe. Bye-bye.